Good morning, folks. I am Dr. Akshay Pradhan, faculty cardiology, King George Medical University. I'm an intervention cardiologist, and today we'll be discussing an important issue at our hand, that is hypertension, on the occasion of World Hypertension Day. Okay, that's a great question. So the focus has shifted from clinic blood pressure to home blood pressure monitoring, or rather you can say office blood pressure to non-office blood pressure. That means currently across the world, the blood pressure measurements are generally more preferred when they are taken in a non-office setting, that is at home. So you have now lot number of automated BP measuring instruments. They are very cheap, they are handy, and once the machine is calibrated, you can measure your blood pressure at home, because the home blood pressure is more reflective or true reflective of one's hypertension status and what the load which the hypertension puts on the cardiovascular system. Right? Because once you go to the office and measure the blood pressure, generally because of anxiety, because of other factors, there is slight variation or false elevation of blood pressure, which is called as white coat hypertension or white coat effect in hypertensive patient. Right. So more and more now we prefer that the first measurement can be in office, but the subsequent follow-ups should be based on home BP measurement. Right, with the commonly available automated BP measuring devices. Okay, good question. That was a burning question in the first wave, because the receptor for the SARS-CoV-2 virus was the ACE receptor, which is also the spike protein, right? So many people initially thought that drugs which affect the renin-angiotensin system would be dangerous. But now it is clearly proven that all types of antihypertensive drugs are generally safe. So whatever drugs which you are continuing, you keep continuing, right? Yes. Irrespective of your status. So all drugs are safe, and hypertension is an important risk factor for mortality in COVID-19. So antihypertensive drugs, irrespective of that type, should be used based upon your, you can say, physician preference. Whatever physician or your doctor has prescribed you, you should continue taking that drug without failing. Okay, so when we treat blood pressure, we are primarily not looking at numbers, right? Blood pressure itself might be innocuous or without symptoms, but it produces three important system damage. That is the cerebrovascular system or the brain, the heart, and the kidneys. Right, and if you specifically look at heart, then blood pressure is a major contributor for two major cardiovascular diseases, or maybe three. One is the heart failure, second is the heart attack or myocardial infarction, and third is atrial fibrillation or irregularity of pulse. So if you control blood pressure, your contribution or its contribution to both myocardial infarction or heart attack or heart failure or left ventricular dysfunction or atrial fibrillation or a pulse disorder, all these three important drugs is cut by at least 1/4 to 1/3. So it is not just your blood pressure is getting controlled, but additionally, especially for the heart, you're getting benefits in terms of heart failure or heart attack or irregular pulse, and simultaneously you're also getting prevention of stroke, that is the heart attack of brain, you can say attack of brain or vascular attack of brain, and you are also cutting down you can say kidney damage. And there are other system involvement like the retinal damage or peripheral vascular disease. So wherever there are vessels, the hypertension is going to, or elevated blood pressure is going to harm those vessels. Subsequently, those organs will produce symptoms. Right? So whenever you decrease blood pressure, remember that it's not only numbers which you are curtailing, you are also preventing damage to these vital organs. Right? And as I said previously, with respect to heart, three major complications, that is heart failure, heart attack, and irregular pulse or atrial fibrillation. These are the three major, you can say, complications which are prevented. So hypertension is globally prevalent disease affecting all countries, all races, and all sexes. 1 in 4 male or 1 in 5 females is now suffering from hypertension. The diagnosis is very simple, as I said, with the commonly available instruments. Therapy is also simple with the available single daily dosing pills, but only challenge is that duration is lifelong. according to the current data. Maybe we don't know in future we might have a single device-based cure, but currently you have to take the therapy lifelong. And so two-prong attack is needed: drugs which are prescribed by physicians, and lifestyle modification in the form of you cut down the salt in your diet, you take more fresh and fruits and vegetables, you cut down on alcohol and cigarette, and do some form of exercise. So help us if in fighting this menace of hypertension. As physicians, we cannot fight this menace of hypertension alone. We need your support. So lifestyle intervention, by opting lifestyle intervention and by taking drugs regularly, we all can join hands in fighting this menace together. Thank you.